My name is Emily Campa. It is May 23rd, 2025, and it is currently 14:28, and I will be doing my head to toe.
Come in.
Good afternoon. My name is Emily Campa, and I will be doing your head to toe, and I'm a student nurse, okay?
Okay.
Here's my badge. And now I'm going to be getting hand sanitizer. I will be putting on my gloves, and then I will be checking if the bed is locked. Yes, it is. I will also be elevating the bed to my level. How are you doing, Mrs. Sala?
I'm doing good, thank you.
Okay. Can you your name and date of birth, please?
Isela Gonzalez, May 2nd, 2005.
Okay. So how are you doing today?
I'm doing very well.
Okay, that's great to hear. So do you know why you're here?
Yes.
So we are going to be doing a head to toe today, okay? I'll be elevating this to my level. So before we start, it is going to be like about a 15-minute head to toe assessment. And what it's going to be consisting of is I'm going to check literally from your head to your toes. I'm going to check for any abnormalities, anything different out of the norm, okay?
Okay.
So before we start, do you need to go to the restroom?
No.
No? Are you comfortable in this position?
Mhm.
Yes? Okay. So we are going to get started, okay?
Okay.
So I'm going to start by checking your head, and I'm going to check for any bumps, any lesions, any, I would not want to say this, but we're going to check for lice. So does this hurt? No? Any pressure, any tension? No? Okay. Then I will also be checking your ears, behind your ears as well. Okay. No bumps, no lesions. And then I'm gonna grab my pen light and then go ahead and check your ears. I'm gonna pull up and back. Okay, everything seems great. So how do you clean your ears?
Hydrogen peroxide.
Okay, that's great. So we want to make sure that when we use Q-tips, we don't push your wax in because that can damage the ear. Okay, the back seems great. No tension here, nothing hurts?
Nothing.
Okay, sounds great. Now I'm going to be checking your forehead and your sinuses, okay? Do you have any tension there?
No.
Any stress you're going through right now? No?
No.
That's great. Does that hurt?
Mm-mm.
No. Now I'm going to be checking her lymph nodes. Does that hurt? No? Okay, great. So I'm going to be checking her eyes. Face does look symmetrical. So I want you to follow this, the tip of the pen.
Okay.
And I'm going to be checking 6 points. And I want you to follow just with your eyes, not your head, okay? Do you want to start over?
Mm-hmm.
Yes?
Yeah.
Okay. Okay. So you were kind of having a little bit of trouble following.
Mm-hmm.
Are you sure? Do you want me to perform again?
Sure.
Okay. Here you go again. Just stay focused on the tip, okay? Okay.
Mm-hmm.
So I do recommend you go with an eye doctor because you're kind of having trouble following through. Maybe your depth perception. Okay. So I want you to focus right here on my shoulder, just on the edge, okay? And then when I tell you to look, when I say go, I want you to look at that white thing on top, okay?
Gotcha.
So on the count of 3, you look over there. 1, 2, 3. Okay, great. Great. So now I'm going to be checking your nose and mouth, okay? Can I just have you and then can you open your mouth, please? So I am going to be using I will be using my tongue depressor, and I'll be pushing down her tongue, and I'll be looking for any sores, anything abnormal. Okay. So can you please open? Can you say ah? Does that hurt? No. Can you lift your tongue for me? Okay, great. How often do you go to a dentist?
2 months.
Every 2 months? Okay, that's great. That is actually great. We do recommend our patients go every 6 months. And you are doing much better than 6 months, okay? So I am gonna go ahead and check your neck. So I already checked the lymph nodes. Now I want you to look up and swallow, please. Okay, it looks like your trachea is deviated. Can you look to the left? Okay, can you look to the right? I was checking for any jugular vein distension, which clearly you do not have. So now I'm gonna change out my gloves. And are you okay? Do you need water? You need a break? No?
Yeah, I'm good.
Okay. So we are gonna having trouble
You're
putting
okay.
my gloves on.
You're okay.
Can you flex your neck for me, please? Okay, great. How about, okay, great. Have you done this before? Yes, okay. Great. So, I am gonna move down to your chest area, but I'm gonna first check your pulse, okay?
Okay.
So this I would just wanna check for 1 minute and not bilaterally. Okay, is everything, it's normal and it is strong. So now I am gonna go in with my stethoscope and I'm gonna check your heart sounds, okay?
Okay.
So it would be right here. This is my aortic, pulmonic, Erb's point, tricuspid, and mitral, okay?
Mhm.
So let me go ahead and listen, okay?
Okay.
They all sound strong, okay? So now I am gonna go ahead and move on to your lung sounds. So
Okay.
I'm gonna start right here, and then go here, 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 here. So it's just about 10 points, and then 3 on your right, 2 on your left, okay? I'm gonna go around the other way to check the 3 lobes, okay? Okay, great. They all sound clear, okay? So now I'm gonna ask you to please come forward, and I'm gonna do the same on the back to check your lung sounds, okay? So I am gonna move this so the camera can see the points that I'm doing.
Oye, ¿sabes qué se te faltó? Is it recording? Yeah.
So on the back, I am gonna start here, and I'm gonna go here, 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 and then down here, here. So it's 1, 2, 3, 4, 5, 6, 7, 8. And then on the right, it's gonna be 3, and then 2 on the left, okay? I'm not sure if I was in the way while I did that, but I tried to show the points. Okay, now I'm gonna put this back. Here we go. Okay, I don't know if the camera can see that. Okay, I think that's good. So I did hear really good clear lung sounds. So that was for that. So one thing I did forget was to check your eyes. It won't take long though. It was just checking, and I'm not gonna touch. Okay. So I'm gonna shine light in your eyes, and I want you just look forward, and I'm gonna check. Okay. Okay. So they do react really good to light. Okay. So now I'm gonna move on to your abdomen. Okay.
Okay.
So I'm gonna lay you flat. Is that okay?
Yeah, that's
Okay.
fine.
Please tell me if you're in pain or if you want me to stop. Okay. Are you comfortable in this position?
Yes.
Okay. So I'm gonna put this down so I can work. Okay, so I will be listening to your vowel sounds from the right to the left. Okay, so I'm gonna go here, 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 here. Okay? So right lower, right upper, left upper, left upper, okay? So you do have active vowel sounds, and that's really great. The reason why I went in that direction is because I was following the codon, okay?
Okay.
Great. So at that point, I already checked your carotid, I would check your brachial, I would check your radial for a minute, and then your femoral, and then already go ahead and do wavelength. Tell me if this hurts. No? Okay, so no, just to the abdomen. And then I'm gonna percuss. I'm gonna put my 2 fingers and then hit the top of it to see the sound, okay? Does that hurt? Any pain? Okay, great. So I have inspected her arms. I'm gonna check her skin trigger. I'm gonna go ahead and check your capillary refill, which it has to be less than 3 seconds. Okay, great. You're not dehydrated. So now I would proceed by inspecting her legs, inspecting that there are no bruises. If there are bruises between the legs, I would want to report that. There aren't any bruises. I would check her popliteal pulse, and then I would go on to check her dorsalis pedis and her tibialis anterior. Okay. And then I do want to perform a range of motion with you.
Okay.
So I'm gonna put you back up, okay? trust my hands. I'm gonna put out 2 fingers and I want you to squeeze as hard as you can. Okay, great. And then I'm gonna put my hands like here and I want you to push down as hard as you can. Okay, I'm gonna put them above and I want you to push up as hard as you can. And I'm gonna put them like this and I want you to bring apart. Okay, now I want you to
Okay.
push them together. Okay, great. You have really good range of motion. Now I'm gonna do the same with your legs, okay? So I would stand right here, her feet, and I would want you to push down when my feet are in. Okay? I'm gonna put them my hands above, and I want you to push up. Okay? Now I would put them in between, and I want you to push your legs in. Okay? Now I put them like this and position out. Okay, great. And then I'm gonna take off your sock. Okay?
Yeah, that's fine.
I would take off both your socks and check the capillary refill on both. Okay, great capillary refill. Her feet are warm and there are no bruises. And then I'm gonna put her socks back on. So did you have any pain? Nothing? Okay. So are you sexually active? Okay, so I just want you to make sure you're safe. I want you to please use a condom. Any others type of protection, please.
Okay.
We want to prevent any STIs, STDs. Please make sure you're safe, okay? So now, I'm gonna put your bed down. And I'm gonna assist you to put your shoes on, okay? That's when it goes down. Okay, so now I'm gonna help you put your shoes on. There we go. Okay, just on the edge, and then I would take your blood pressure again to make sure to check for any orthostatic hypotension. I don't want her to be dizzy. Are you feeling dizzy right now?
No.
No? Any pain?
No.
Do you need to go to the restroom?
No.
No?
Okay. I was expectations.
Okay, so I would make sure she has grip socks. Okay, so we won't slip and fall. So now we are going to perform a test that is called Get Up and Go. So
Okay.
without using your hands on the bed to help yourself, I want you to literally get up and take a few steps, okay?
Okay.
Before you hit the wall. Okay, I'll do 1, 2, 3. Okay, great. Now I want you to walk 5 steps this way. Okay, so now I'm gonna turn back and do it again. 1, 2, 3, 4, 5. Okay, now I would like you to come over here. And as best as you can, I would like for you to reach for your toes, and I'm just gonna be checking your column, okay? I want to make sure that you don't have a deviated column. We're just checking. I'm gonna put my 2 fingers and follow it with my hands. And yours appears to be straight. Now I want you to hug yourself like this. Lean a little bit forward. And then I want you to say 99 loud.
99, 99, 99.
Okay, sounds great. So that is it. I did check your chart. Everything was great. You were in
Okay.
great condition. And I'm gonna assist you back to your bed. Put her in the comfortable position. I would cover her up. Make sure the bedrolls are down. Give her her collar, give her her belongings. Make sure the bed is locked. Both girls are down. And then open up the curtain. And that completes this head to toe. Are you comfortable with this position?
Yes.
Do you have any pain?
No.
Do you need to go to the restroom? Would you
No.
like me to assist you? No?
Everything's
Okay. Sounds great. Thank you.